Welcome to Part 5 of QAPI, What You Need to Know for the Long Term, Tools and Resources. I am Sheila McLean, Area Manager with VHQC, and presenting with me is Mary Childs of Childs Consulting. In this session, we will review tools and resources that will help support the implementation of QAPI. As we walk through the tools and resources, you will find that you have many of these items in place and actively use them in day-to-day operations. In this session, we will examine how to leverage resources to sustain continuous quality improvement. We will explore external tools, internal tools. We will also take a look at guiding resources from CMS and also review some resource websites that you will find useful in your implementation of QAPI.
Thank you, Sheila. Let's now examine some of the tools that we have readily available to us. Both the CASPER report and the CMS 5-star report provide a wealth of objective measurements and information on both an individual, state, and national level. It is critical that facility staff and other users of this information understand how this data is obtained. First, the facility staff must have understanding of MDS coding guidelines and how coding in one section of the MDS may impact a totally separate quality measure. Next, we must understand computer logic that is embedded within each measure and understand the timing and the schedule of each report. These reports are indeed multifaceted. The CASPER report has information that allows a multi-focus comparison depending upon the column that is being reviewed. For example, the facility adjusted column is all about your facility. It is about you. It is not impacted by actions of others, and this is updated each time that you transmit assessments to the federal database. The state level reporting column compares your score, the score of your organization, to the rest of the state. It is updated on a monthly basis. The national percentile column, this is the last column on the right, is the column that compares your data to the rest of the nation. This column is updated on a quarterly basis. Both the state and national data ranking comparison is retrospective, and your comparison to others is affected by what they are doing. The CASPER report has much information on it, and while it is very useful, it can also be a little misleading based upon the formulas used to calculate a specific measure. For example, a facility could have a low score on UTIs due to the MDS definition and the timing of the MDS lookback period. But in reality, the facility could have significant opportunity for improving acquired UTIs. In Virginia, the CASPER report is used to drive the survey process. When a facility triggers at 75 percentile, the surveyors will use this opportunity to evaluate the systems and the processes that the facility has in place regarding that particular measure and seek to determine whether the facility is compliant with related regulations. This slide also demonstrates a 5-star report. This report is generated by CMS and is updated on a monthly basis. The nursing facility may obtain a preliminary copy of the report from the MDS submission website. However, CMS publicly reports these findings on Nursing Home Compare, and we will examine the details of Nursing Home Compare in the next slide. Information about all nursing homes that are certified to provide Medicare or Medicaid services can now be found on the internet at Nursing Home Compare. Over the recent past, this site has been undergoing multiple updates in an effort to improve the information that consumers have available to make the best decisions they can when choosing a nursing home. Let's talk about some of those changes. First, public perception. The public can now compare one nursing home to another. You are able to do the same thing. You can compare your competitors. You can compare all the nursing homes within a zip code, within a region, or any that you select. Now, as you begin to look at that information and compare, these are some of the things that we can find. First, we can find the most recent health inspection information about the facility. This information was recently updated, and now you not only get the essence of the deficient practice, but you can also easily identify the scope and severity of each deficiency. Secondly, this information provides details about staffing, and they look at this in a variety of levels, nursing as well as physical therapy. This information is generated when the facility has their annual or their standard visit and they complete the 671 or the CMS form, in which they have to self-report staffing during a designated period of time. This is not about what you budgeted. This is about the actual number of hours that was worked during a given period. Next, we have opportunity to look at quality measures. Under the quality measure section, you will be able to identify and compare yourself. It will indicate whether you are above average, average, or below average in certain measures as it compares to other localities across the nation. This website also provides organizational information. It identifies whether you are certified for Medicare or Medicaid. It identifies whether you are for-profit, not-for-profit, etc. Information about penalties is now added to this website, and any penalty that has been applied by CMS during the last 3 months is now publicly reported in the term of the dollar amount. This report does not identify why that penalty was applied. Information found on this website is the most current that CMS can publish, but it may not be the most current in terms of when something occurred. For example, CMS will not publish information until all the appeals process have been exhausted. So this allows the facility the opportunity to identify and monitor what is different, and also gives us the opportunity to be able to explain why something would be different, because what is seen on the public website may not be reflective of what your current practices are. For example, your staffing report could have occurred during a period of time in which there was an outbreak in your facility and staffing was a challenge, but in reality that is not your typical staffing pattern, so you would want to be able to explain that. Anytime that we have an opportunity to demonstrate how we have improved something, because this is all retrospective information. So you may have corrected a process, you may have developed a new process geared toward resident and customer satisfaction that will not necessarily be demonstrated until you have an opportunity to be surveyed again.
Thank you, Mary. Let's continue to review some other external tools and resources. Here on this slide, we have the Advancing Excellence campaign. This campaign was established in 2006 by a coalition of 28 organizations representing providers, nurses, caregivers, medical directors, quality improvement professionals, consumers, and government agencies. The campaign is a voluntary quality improvement initiative to help make nursing homes better places to live and work. Phase 1 of the campaign ran from 2006 to 2009. We entered Phase 2 from 2009 to 2012, and currently we are now in Phase 3 of the campaign. The campaign provides a selection of goals for facilities to choose from, and you will see the list of goals on the right-hand side of your screen. For each goal, the campaign provides tools and resources. Please contact VHQC if you have questions regarding the Advancing Excellence campaign or need assistance with signing on to the campaign or accessing your facility's information. Another resource provided to you is VHQC. VHQC is a private, non-for-profit healthcare quality consulting firm and the quality improvement organization for the state of Virginia. We work with all providers across the state to improve the quality of care patients and residents receive. We have been the Quality Improvement Organization, or QAO, since 1984. VHQC's consultants come from a wide range of healthcare backgrounds. Our experienced team includes former hospital executives, nursing home administrator, physician practice managers, nurses, health information managers, health communicators, physicians, and pharmacists. Building on our QIO experience in electronic health record adoption, data reporting, and care coordination, we also serve as Virginia's statewide regional health IT Extension Center. This is also known as Virginia Health IT Program, or VHIT. VHQC focuses on spreading healthcare improvement, and we are dedicated to improving population health. For example, in working across different healthcare settings, in 2013 we conducted a C. diff collaborative. In this collaborative, we brought hospitals and nursing homes together to help reduce the incidence of C. diff. The National Nursing Home Quality Care Collaborative is a national collaborative led by CMS. This collaborative is a fast-paced, dynamic, data-driven quality improvement initiative. It focuses on addressing system-wide issues and opportunities for improvement of healthcare acquired conditions in order to improve the overall quality of care of nursing facility residents. The Virginia Learning Network is part of this national collaborative. Through this initiative, we strive to instill quality and performance improvement practices, eliminate healthcare acquired conditions, and dramatically improve resident satisfaction by focusing on the systems that impact quality, such as staffing, operations, communication, leadership, compliance, clinical models, quality of life indicators, and specific clinical outcomes. The Learning Network brings together healthcare professionals, residents, families, and other stakeholders around an evidence-based agenda to achieve rapid, wide-scale improvement. The Learning Network model includes collaborative projects, online interaction, and peer-to-peer education to facilitate a shared commitment, energy, and knowledge that allows all participants to learn from each other as well as from other experts. This initiative, along with the National Collaborative, is facilitated in Virginia by VHQC. If you are not part of the Learning Network and would like to be, please contact VHQC and we will provide you more information on how you can become a part of the Learning Network. Remember, it is never too late to begin quality improvement. Our industry's trade associations offer a wealth of knowledge and educational opportunities. In Virginia, we have two trade associations, Virginia Healthcare Association, with the American Healthcare Association as the national organization, and the Virginia Association of Nonprofit Homes for the Aging, with Leading Age as the national organization. Some of you may be familiar with and maybe even using INTERACT. INTERACT stands for Interventions to Reduce Acute Care Transfers. INTERACT is a quality improvement program that focuses on the management of acute change in resident conditions. It includes clinical and educational tools and strategies for use in everyday practice in long-term care facilities. Its goal is not to keep all residents from the hospital, but to provide expert care in the least dangerous and disruptive place in the most timely way possible.
My Interview and Team TSI are both companies that provide performance measurement and improvement services offerings, plus staff and consumer satisfaction surveys. Both charge for their services, and depending upon the services that you purchase, the facility can gain access to data analysis and benchmarking data. These programs offer the kind of online data-focused tools that long-term care providers need for improvement of reimbursement, survey preparedness, event tracking, and more. With 24-hour online access to these tools designed for healthcare data collection, reporting, and analysis, facilities can effectively enhance both quality and compliance. Dynamic dashboards and customizable reports are often provided by these facilities, and these assist you in analyzing data and trends and comparing yourself to a national database of peers that subscribe to these programs. Many organizations have various types of scoreboards or spreadsheets that provide month-to-month comparisons. Sometimes these measures are individualized to a facility, and in other times they serve as a means to compare one facility to another within an organization. The examples on this slide include a scoreboard on the top that was designed for a corporation that had nursing homes, while the one on the lower part of the slide was designed for an assisted living facility. Mock surveys can play a critical role in your organization. These mock surveys do not have to be done by an external contractor. However, when doing them internally, it is important that the reviewer place a surveyor hat on and that the review be done candidly and without allowance for internal insight into an incident or to an observation. The primary purpose of a mock survey is to identify your risk factors so that you can correct when appropriate and then investigate your findings. Is this a systems concern, or are these findings representative of individual performance or education? When investigating and assessing the identified risk, you must determine who else could have been affected. What changes are necessary to promote compliance and improve outcomes? When and how will I know if the changes that you have made will meet the expectation? Many organizations have some form of clinical report that they complete on a regular basis. Sometimes this report is generated to the organization's Quality Assurance Committee. Other times it is a separate report that is often submitted to a corporate office. The example seen on this slide is a clinical operation report that provides the facility an opportunity of monitoring multiple measures month to month. Quick identification of variances and quick method of comparing their ongoing outcomes is critical to this review. The clinical operation report can cross and should cross over many departments and systems. For example, it can track admissions and discharges. It can look at rehospitalizations and/or the number and frequency of ER visits. It can track infections, whether they be acquired or admitted. It should look at falls and other related types of incidents. You can track pressure ulcers. You should also be able to look at other tasks such as MDS completion and transmission. You can monitor the number of residents that are receiving special services such as hospice or restorative nursing, or those that are on a pain management program. And last but certainly not least, you can begin to track customer service concerns. These will allow us then to drill down and know where to place your focus. QAPI is not entirely new, and it does not always require a great deal of additional tools or resources. More often, it's how we utilize the tools and resources that may be different as you explore opportunities for improvement and not just focus on deficient practice or adverse outcomes. You have to understand the tools that you are using and how they can best be utilized. For example, a good 24-hour report form has very useful information in identifying an incident or an acute change. However, this form does not assist you in tracking or identifying trends and patterns that could be related or important to your ongoing care. An audit tool used to monitor staff compliance post-fall is a good way to identify an opportunity within one record or one incident. But looking at all of the audit tools completed post-fall and using that tool will give you information on trends and patterns and will assist you in analyzing outcomes and how you may need to focus additional education or refine systems. Tools are valuable in communication. They help to keep us organized. They provide information in a quick and meaningful way. Visually, they often jumpstart ideas. We see something not just to hear a bunch of data or a bunch of numbers, and they can serve to also validate improvement. QAPI plans, including goal setting, is very much like developing a personalized care plan for your residents. However, your focus is going to be on the organization. Goals should be stated in a way that can easily be understood and in a manner that allows everyone to know what you hope to accomplish. Goals are where you want to go in the future, what you want to achieve in a measurable term. Goal setting should be realistic for the facility. Let's be honest, having a goal of 0% is not realistic for each measure or each opportunity that you desire. Oftentimes we set goals within goals, or sub-goals for example. We can establish a goal regarding the overall number of acquired pressure ulcers. You first want to determine what that number is, but it's also important that you determine the length of time in which this will be measured. For example, will you measure it over a month, a quarter, 6 months, etc.? Within that goal, you can then establish a goal based upon the stage in which the pressure ulcer is first identified. Let me give you an example. Your overall goal is not to have more than 3 acquired pressure ulcers per month. However, as a sub-goal, your goal is that 2/3 of the acquired ulcers will be discovered at a stage 1 or a deep tissue injury. Hopefully that will allow treatment to be implemented immediately with a greater potential for quicker healing and of unavoidable decline for the resident. Goals can be stated in terms of reduction or improvement. For example, we want to reduce the monthly average number of residents receiving antipsychotics by 20% over the next year. Or we want to improve the percentage of pressure ulcers first identified at stage 1 or deep tissue injury by 20% over the next year or the next 90 days. One of the tools that you have readily available to you is QAPI at a glance. This tool can be, as indicated in earlier discussions, can be found on the CMS website and provides additional information and assistance with goal setting and additional examples as well.
Beginning with this slide, we have listed some websites. First, we have Advancing Excellence. We discussed Advancing Excellence a few slides ago. I would encourage you to visit their website to explore the tools and resources available. Next, we have Interact. Again, we have reviewed Interact for you, but you can visit the website to explore all of their tools and resources. Next, we have Implementing Change in Long-Term Care. This is designed by the Pioneer Network to assist organizations and the staff who work there to implement changes that will improve quality of care. Whether you're contemplating a comprehensive organization-wide culture change or implementing a best practice protocol in a single clinical area, Knowing something about how to implement and manage change will help you achieve your goal. You will find suggestions about preparing your organization for change, assisting your staff to gain a sense of ownership over the changes, and sustaining the changes over time. Not all sections of implementing change in long-term care will be useful to everyone. Look for what you think is the most useful and start there. Picker Institute Publications is noted next. Picker Institute sponsors education and research in the field of patient-centered care in cooperation with educational institutions and other interested entities and individuals. The Institute's goal is to foster a broader understanding of the practical and theoretical implications of patient-centered care by approaching health care with a focus on the concerns of patients and other healthcare consumers. VHQC offers a wealth of free resources and tools. Please visit our website and join our online community so that you have easy access to these tools and resources. There you will find the QAPI tools mentioned in this series and additional supporting resources such as PDSA worksheets, Performance Improvement Project worksheets, and QAPI talking points. In addition, you will be able to access a change package developed by CMS for the National Nursing Home Quality Care Collaborative and the Virginia Nursing Home Quality Care Learning Network. The change package is a living document that seeks to provide a menu of strategies, change concepts, and actionable items from which you can choose from and begin testing for improvement. Plus many more tools for improving areas of focus such as staff stability, consistent assignment, infections, pressure ulcers, antipsychotic medication reduction, and rehospitalizations. And finally, we list the websites for CMS QAPI resources. The CMS QAPI websites offer access to QAPI at a glance and associated tools and resources. CMS does update the website as new tools and resources are developed. This concludes our review of tools and resources. Please join us for Part 6, where we will explore how to create a culture of sustainability for performance improvement.